This episode of the Beauté by ABIC podcast is brought to you by Candela Medical Australia. Hello and welcome to the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we are strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is Beauté by ABIC. Today's guest is Alison Webb from Cutis Dermatology. Alison is a registered nurse and dermal clinician with over 4 years' experience in dermatology. She is passionate about all areas of medical, surgical, and aesthetic dermatology, but has a particular interest in utilising laser and light-based devices to help patients reach optimal skin health. She finds treating pigmentary and vascular concerns particularly rewarding. Alison enjoys keeping up with the latest in dermatological advancements to ensure patients receive a high level of personalised and compassionate care. From Cutis Dermatology, today we welcome registered nurse and dermal clinician, Alison Webb. Welcome to the podcast, Alison. How are you?
I'm good. Thank you so much for having me.
Oh, you're very welcome. I was quite excited to talk to you today. We're going to start our podcast the way we always started, and that's to tell us a little bit about how you came to be in the professional beauty and aesthetic industry.
Yeah, so I entered the beauty industry back in about 2016. So I've always had a keen interest in aesthetics and beauty, but I was actually studying law at the time, which I quickly learnt wasn't for me, when one of my close friends introduced me to the Bachelor of Dermal Science that was offered by Victorian University. And I remember kind of us scrolling through the course outline and looking at the career opportunities that were listed. So I decided to step away from law and I pursued beauty therapy and the Bachelor of Dermal Science. I studied through Torrens University as their first cohort of the dermal science students. And then when I was studying, I reached out by email to multiple skin clinics, plastic surgeries, dermatology practices, pretty much, I guess, asking or even begging for just some sort of kind of hands-on work experience. A few months went by, still really didn't hear anything. And then finally a dermatology nurse practitioner, she was nurse at the time, dermatology nurse, Emily Fenton, who I believe has also been on the channel in the past. She finally replied to me, and I think it was almost because I just didn't leave her alone. It was maybe the third email, and she was like, fine, come in, watch what I do, like see how we work. So I did that for a few weeks, and then I was offered an employment in dermatology, and I've worked in derm ever since.
But you were also a nurse.
Yes. So once I graduated the dermal science, I was working in dermatology practice, and then I was very fortunate that dermatology practice offered multiple services of medical, surgical, and cosmetic derm. So even though I was able to work autonomously as a dermal clinician or in collaboration with the doctors and nurses, I was exposed to more of the medical, surgical aspects of derm that really did excite me. So I then pursued nursing really to kind of broaden my scope within the field. And I do think that now, whether it's, like providing wound care or running my own laser list or even assisting intraoperatively, that the combination of dermal and nursing has kind of really set me up to provide patients with really comprehensive care. So it's been a nice combination, definitely.
Absolutely. It's a really amazing combination, actually. It gives you such a larger scope of practice, doesn't it?
Yeah, it does. And you really don't learn, honestly, any derm in nursing at all. So having the two combined and like the dermal as my foundation gave me a lot to grow on, which was good.
It's fascinating. You also work with Dr. Davin Lim, and he's the owner of Cutis Dermatology.
Yes.
He's actually made quite a name for himself, and He's so extremely knowledgeable. He's also a representative for a number of, really great industry brands. It
Yeah.
must be really inspiring working with someone that's so renowned for his skill and also pushing the envelope when it comes to treatments.
Yes, Davin is quite the character. He often gets bored easily, so he's like, I'm always, trying something new. I want to do something new, and he reckons it's every 5 years, but I honestly reckon it's about every 5 minutes. But it does make the job exciting.
Hard to keep up.
He is. He just operates at 100 miles an hour, which is good. It's exciting, and we are working with him means we're fortunate to be associated with these brands, and it allows us to experiment, or I would say take educated guests, often usually on his family members too, with the latest technologies that are available. So he really encourages us to continuously learn. He challenges a lot of our ideas and kind of keeps us evolving with the industry that we know is changing literally daily. So yes, keeps us on our toes, that's for sure.
Mm-hmm. It's funny how you say the industry is literally changing daily.
Oh, honestly,
I couldn't agree with you more. And, it's such a fast-paced
it is.
environment and industry, but
Yeah,
we're learning every day.
every
It feels
day.
like we're learning more and more, isn't
Yeah.
it?
It's funny. I'll be scrolling on socials and I'll see the latest crazes happening, and I'm like, oh, that's so interesting. And then for a minute, I'm like, Alison, come on, like, you know how you work. Like, this is just a craze. So yeah, literally every day, but it's good. It's exciting.
Oh, look, there's so many treatments to choose from.
Yeah.
And you're right, scrolling through
So
scrolling through social media can be dangerous sometimes. But obviously, you've got your staple treatments in clinic.
mhm.
Of those, which one would you say is your go-to? What's your favorite one, I suppose, to perform in clinic?
I honestly feel like every time I answer this question, I'm kind of cheating because I really do enjoy using pretty much all of the devices we house. But if I had to pick one, it would probably be, it's not even really one now that I think about it, but would be a combination treatment of the high density 1927 thulium with a fractionated CO2. So the 1927 thulium we perform to full face, and then we might go in with the CO2 to areas that require maybe a bit of additional resurface or collagen remodeling, so maybe to the eyes or upper lip. And this tends to be on more of that mature sun damaged skin. So you do need to pick your patients and pick the time of year that we treat, but if patients can't always commit to the downtime, there's definitely other modalities that we can offer these patients, but maybe over a course of treatments rather than a standalone.
Why do you love those two treatments over and above?
I find, well, I find that they give the biggest wow factor in that kind of one-off treatment. You pick up on the sun damage, pigment, tone, texture. You kind of get it all in one hit, and it is kind of the biggest wow before and after in one session. And yeah, patient satisfaction is definitely always very high.
They're a little, some, can be a little bit more invasive. Are they the most popular treatments that you have?
Look, yeah, it would be one of our commonly performed treatments. Like obviously living in Queensland with the type of skins that we do see, it is definitely one of our most popular treatments, but it goes hand in hand with a lot of our non-invasive treatments as well.
Very fascinating. You also have pico lasers, right? They're becoming more and more popular. And so, there's a lot of treatment diversity in them as well. Do you actually use Candela Pico Way in your clinic?
Yes, yeah, they are. Pico lasers are becoming more and more popular, but yes, we do house a Candela Pico Way. They are originally brought out because they were the revolutionary treatment for faster, clearance of tattoo ink, which is definitely still the case, and we do apply it for tattoo removal at Cutis. But they've proved to be so much more than just tattoo removal in recent years. So at Cutis, it's kind of our go-to treatment for any sort of pigmentation concerns. With their shorter pulse durations and higher peak powers, we're just finding greater clearance of pigment or ink in fewer sessions and with a lot less risk of, adverse effects such as post-inflammatory pigment.
We're hearing that a lot, but you can also perform other treatments on the Pico way. Is that
Oh
right?
yeah, absolutely. That's probably my favorite thing about the device is just how versatile it can be. So it offers multiple wavelengths, multiple hand pieces. You can treat anything from benign pigmentation concerns such as freckles, lentigos, birthmarks, again, tattoo removal. But then with its fractionated handpiece, it offers higher energies, which means that we can tailor treatments to target, other concerns such as acne scars, fine lines, rejuvenation, pore size. So yeah, it's kind of an all-in-one treatment. Definitely very versatile.
And community, if you're wondering, apart from the incredible education provided like the knowledge shared in today's conversation, what sets Candela apart, it's their commitment. From the day you become a Candela customer, you experience a true partnership. With the purchase of a Candela device, you receive a 3-year service warranty, clinical training for you and your team, as well as access to their comprehensive marketing resources. Your success is their success. To find out more, visit www.candelamedical.com.au.
How is the rejuvenation side of the Pico way? You're seeing a reduction in fine lines and that scarring lifting?
Yeah, absolutely. It's a really nice option for patients who can't commit to something like a CO2 or whatever it may be for acne scars. Obviously, it does require probably more sessions, multiple sessions over a period of time. But we are definitely getting some good clearance, and we find it to be especially useful for the ethnic skin types. They really like the rejuve that the Pico Way provides, which is
is that one of the reasons why you actually went with Pico Way? Is that the more diverse skin types that you can treat? What are the other things that made you choose it?
Oh yeah, lots of different sort of skin types, conditions, but the actual technology of the device, it offers the shortest picosecond pulse on the market. So this means it can deliver less heat than other devices, which is why it's a safer and more comfortable treatment for patients. It offers high peak energies, as we discussed. It's very customizable. You can start off with one wavelength or 2 wavelengths, and then you can upgrade in the future, maybe as your practice upgrades. There's no consumables, which is great from a business perspective. And I guess Candela offer great ongoing support and education. So yeah, it was definitely, I would say, easy choice when it came to the Pico Way.
And patients these days, you said that you probably need a little bit more treatments with the Pico Way, but patients are all about fast treatments, low to no downtime these days.
Yeah.
How does that ethos sort of feed into the treatments and devices that you offer at Cutis and also with the Pico Way?
Yeah, look, everyone wants flawless skin and they wanted it yesterday, but I guess it just depends on what we are treating. So I do believe that there'll always be specific conditions, things like melasma or, tattoo removal that require multiple sessions over an extended period of time. And unfortunately, speeding up these processes isn't always safe or appropriate. But
absolutely, I totally agree with that.
What we are finding is that, concerns such as fine lines or scarring, sun-induced pigment, that people are opting not for treatments such as maybe needling, RF, CO2, the thulium that I mentioned earlier, because these are associated with recovery. So Pico Way offers a great advantage because we can target these conditions in, multiple sessions, but patients can essentially go back to work that afternoon or the following day. So yes, there will still always be a place for treatments that require recovery, but it is important that, we give patients the option for lower downtime treatments and something that, maybe suits their lifestyle better.
And so obviously when it comes to protocol and when it comes to prepping clients, what is it that you have to do with the Pico Way?
So again, it pretty much depends on what we're treating, but another great thing I guess I love about the Pico is that it is safe enough to treat with minimal preparation. Obviously, we advocate that patients are complying with strict sun protection in the lead up to treatment. If we're treating pigment, we typically have them commence some sort of tyrosinase inhibitor, perhaps a vitamin C. If we're looking at targeting conditions like pores or fine lines, we might suggest patients commence a retinol or AHAs, really just to accelerate the outcomes of the Pico Way treatments. We also know that, you know, healthy, hydrated skin responds better to any sort of laser therapy. So this is also something we discuss in prep for a Pico. But like I said, it is pretty much a good treatment that anyone off the street could almost come in and have. It's very adaptable to that side.
Are there any other treatments that you typically, you know, what's your favorite treatments to use with the Pico Way?
I really like it well, we treat a lot of ethnic skin types. So the Pico Way offers a 730 nanometer wavelength, which has been kind of our gold standard in treating benign pigmented lesions in the ethnic skins. We know that we can pick up on those lesions in 1 to 2 sessions and get good clearance with really minimal risk of PIH. So I would say, yeah, more pigment or sun damage that I like applying the Pico for.
And do you have any other treatments that you would typically pair with the Pico, you know, for pre and post? Do you do LED or, you know, any other types of modalities that you would use alongside it or in a treatment plan?
Yeah, we do. We offer LED a lot for pretty much all of the devices, like a lot of the procedures that we offer, generally maybe at 1 or 2 days post the procedure. Something that we were kind of working earlier a few weeks ago with was the Pico Way in combination with Candela's Frax Pro, which is similar to.
That's a nice combination.
Yeah, and I got some really good results. Like somebody, I guess, with a little bit of that sun damage or epidermal pigment, the Pico's picking really well up on, but then that Frax Pro is more for that tone and texture and cellular turnover. So the combination of the two gave some really good results. So that's exciting. But yeah, watch this space for that.
Sounds like you've got such a wonderful culture at Cutis, you know, and so many modalities to play with. Lucky you.
Yeah, it is exciting. It's always, keeping us on our toes.
For sure. I mean, and, you know, talking about the environment that you're in, you know, it's so important that you know, to not just your work life, but also for your patients to walk into a clinic that has such a great culture and a really good work ethic. How important do you feel surrounding yourself with people who have the same vision as you, or surrounding yourself with people that, you know, excel so greatly? How important is that for you?
I would say it's probably one of the most important things about my job. Teamwork is absolutely something that we kind of thrive off at Cutis, and I think to really feel kind of fulfilled in your job, you need to surround yourself with people who have kind of that same passion and drive as you do. And I think, like you said, that this kind of just shines through your work, and I do think that patients can pick up on this, and I think it's really important that people understand that the compassion and care that you put into your work, knowing that, you know, you have their best interest at heart. So definitely the most important thing about my job, I would say.
And passion is so important. You know, this industry is run on, you know, results, yes, but it's run on, I suppose, the way that we make people feel and the confidence that we can give them as well.
Yeah.
Is that one of the reasons why you chose to get into this field over law, I suppose?
Yeah, absolutely. Seeing, I guess, patients' confidence when they come back in their skin it's so rewarding. People saying, you know, I'm wearing less makeup, or I'm not avoiding mirrors, or, you know, I'm attending more social events. These are the moments that I appreciate most in my career, because it's so rewarding. You know that when you change someone's skin, you can really change their life. So it's
absolutely. And it's not just in their personal life, is it? I love hearing from patients when they say, oh, I went for that job that I was really wanting, or I've finally got the confidence to present, or, you know, grow their career. They've got more confidence within themselves. It's so interesting how your, you know, outer interface with the world, which is our skin and our face, is so symbiotic with the inner space that we have, right?
Absolutely.
And so what's the biggest lesson that you think you've learned working in the industry?
Probably that it's the, aesthetics or skin is it is so much more than just what we see. It is how you are improving the overall quality of somebody's life, definitely.
Mm-hmm. And if you could say one specific thing that you learnt from working with Dr. Davin Lim, what would that be?
Oh, look, carry a notebook maybe. I don't know. It's like a million things and I'm like, yep, got it. So yeah, it's keeping up with the fast pace. But like I said, it makes the job exciting and we're never really standing still. So it's good.
Oh, that's really good. Well, thank you so much for coming on our podcast today, Alison. It's been an absolute pleasure chatting with you.
I'm excited to be here. I love the channel that you guys offer and all the conversations you have. So I was really excited to be part of it.
Oh, thank you so much. Well, hopefully we'll have you back again.
Yes, thank you.
Thank you. You've reached the end of another episode of the Beauté by ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.